Step into any Holcomb facility and feel welcome.
The families have been very welcoming of the services that we have.
When they reach out, we reach into them and assist them along the way to a different kind of life.
They feel supported, they feel understood, they feel like, thank goodness they found this place.
We are able to really impact people's lives in very broad ways.
People can come in and feel at home, even though they're walking in with some severe problems, whether it be mental health, drug and alcohol situations, homeless situations, or psychosocial type problems with family. We really pride ourselves in the idea that people are going to come in, they're going to feel comfortable, they're going to be treated with respect and dignity, and be able to resolve their problems in an environment that is clean and nurturing.
Holcomb serves more than 12,000 individuals and families annually throughout southeastern and south central Pennsylvania, central New Jersey, Delaware, and Maryland.
People are there to help you, and they care about you, and they just want to see you be successful.
Holcomb provides a comprehensive range of services and supports for people with mental health, substance abuse, intellectual and developmental disabilities, and co-occurring disorders.
If you really want someone to enter into recovery, either from the substance use perspective or from the mental health perspective, you have to treat both issues concurrently and in an integrative fashion.
From infancy to old age, Holcomb provides mental health and psychosocial services in community settings, clinical settings, and in the home. A sampling of services include psychological evaluation and testing, mobile team-delivered counseling for children and adolescents, clubhouse day programs for adults striving to recover from mental illness, community living arrangements for people with developmental disabilities, family visitation services, monitoring child custody exchanges and supervised visits, targeted case management, advocating for people with psychiatric disabilities and their families, and linking them to insurance-covered medical assistance and resources, supported employment for adults with psychiatric disabilities who are eligible and desire competitive employment, and prevention and education programs for children, adolescents, and adults before mental health or substance abuse problems develop.
We value research, we value models that work, and we apply them in our therapy practice.
Taking a holistic approach, Holcomb operates under the principle that every person is unique and has the right to develop his or her full potential. No matter how desperate the situation, Holcomb's professional counselors never give up on their clients.
I do have a client, she's has bipolar, and so when I walked in there was a lot of chaos and family not understanding her. One day I had her draw what she feels like when she's angry and when she's happy, and she drew out all the stages of what she feels like before she explodes and she's just not herself. She now has the ability to explain to us what it is she's feeling and why and what she feels like inside, because she's getting the skills of able to express herself.
Dulce, ¿me ayudas a jugar con Estrellita aquí en el suelo?
To meet the needs of a growing Latino population, many of Holcomb's clinicians and counselors are bilingual, providing services inside Holcomb clinics and going into the community to treat and care for individuals and families in the home, at school, or community centers.
I do this because families are the building block of society. And any one piece of that family that's not working, the entire system doesn't work. And if that system doesn't work, then our communities don't work.
Good job.
Well, I can actually send you some resources on bipolar.
As part of its full spectrum of services and supports, Holcomb manages the only crisis center in Chester County, Pennsylvania, providing around-the-clock telephone counseling and mobile crisis intervention free of charge to residents or to anyone visiting or passing through the county. Often fielding the calls are people who have benefited from Holcomb and want to pay it forward.
Mostly it's that peer-to-peer connection, because I have an idea of where they've been based on my own mental health challenges and treatment, and that starts the conversations and the relationships, bone relationships, off on a higher level, and there's a level of trust and understanding.
In conjunction with the Crisis Center, Holcomb offers one of the best crisis residential services in the country for adults 18 and older, looking for a safe and secure place to rehabilitate.
They don't quite need to go to the hospital because they're in crisis, but they need to be out of their home. So we have psychiatrists here, lots of different groups and activities, we provide all their meals. they come here to get back on track with their mental health recovery.
Always looking ahead, Holcomb has plans to add telepsychiatry to reach rural and isolated communities and to incorporate comprehensive physical health care to allow doctors to treat the body as well as the mind. Holcomb accepts all major insurance plans, Medicaid, Medicare, and self-pay. Contact Holcomb Behavioral Health Systems for care that is comprehensive, compassionate, and customized to your needs and the needs of your family.